Good morning, students. Today we shall resume from where we had previously stopped while we were in college in Medical Surgical Nursing 1. We have started off with Unit 6, which is Operation Theatre Technique, and today we shall continue with the same. Now, as we started off with the topic, we started off with by saying the word sterile, because when we think about an operation theater, what comes to your mind is really it is a place where there is restricted entry. It is meant to be extra clean, and you need to wear the PPEs, your gowns, the cap, mask, your shoe covers, gloves. So this is all what comes to your mind. So this is how we started off with the topic. And sterile here means which is free from bacteria or other living organisms. For example, what we call as a sterile needle or a sterile syringe, sterile tray, sterile scissors, and any other equipment that is used in the operation theater. Now, what is an operation theater? It's a complex environment of varying degree of sterility, integrating surgical and anesthetic equipment for the safe conduct of surgery. So it's a place where the surgery is performed and where you see immense number of advanced technology, embedded machinery or equipments, and where various types of surgeries are being performed. And to add on to that, it is a very strict sterile environment. Now, an operating theatre, also known as an operating room or an operating suite, is a facility within a hospital where surgical operations are carried out in an aseptic environment. I guess this is totally self-explanatory. And we have also seen that our theatres or the operation theatres in the earlier days looked like. So this is what I hope you remember this picture that I've shown you in this. And the current day theatres are like this, which you have seen again during your clinical postings, where you have all the advanced technological equipments and machinery, the tilting table, and the overhead lights, and you name it. So this is what you actually see in the. Also, everything is like considered to be the modular operation theater, where we have sophisticated equipments and instruments, gadgets, and everything is under advanced technology these days. And also, it's trying to make our manual work much more easier. Now, to set up an operation theatre and when a hospital is being built, we need to take into considerations various aspects. And what we really think about is the ideal location of each and every department. So, you know, when you enter into a hospital campus and you see at the entrance you have your the help desk or the reception, then you have your outpatient department, you have your emergency department as well. For, adjacent to it would be your blood bank, your radiology, which includes your x-rays, your CTs, your MRIs, followed by you have your wards, which may include either the pediatric or even the adult wards. And it also includes the intensive care units, the sterile central sterile supply departments, which is very, very important, as well as the laboratories where the investigations and the pathological investigations are being. Planning for this operation theatre. The main intention is now when you're planning setting up a hospital, we know that yes, this is done based on certain objectives or goals. So the first thing is you need to find out the location. You need to know whom are we treating. Is this hospital going to be purely for pediatrics or is it going to be for the adult patients? So that is one thing. So how you categorize your hospitals. Another way to look at it is about the kind of service you're offering. So, most of the time, you've heard them saying the multi-speciality hospital, which means every case can be treated in that particular hospital. But sometimes you have your own ways of saying where you have the cardiac hospitals, you have your nephrology hospitals, your neurology hospitals, or the orthopedic hospitals, or which means only the specific body parts or which is concerned with the bones is being treated, or which is concerned with the heart is being treated, and things like that. Now, the way you plan this is based on functions, that is meaning, and how the size of the hospital, how many operation theaters are going to be set up in that particular hospital, and also what are the different kinds of equipments required, and also how about the installation of these equipments. It also depends, the planning also has to be done for the workflow, which is nothing but the adequate amount of staffs which is required for running the place. It also needs planning on the environmental condition, which is nothing but the lighting, the air conditioning, ventilation, water supply, fire safety, plumbing, And also the technical, which is including the OT staffs, the functional areas, preparation of the patient, sterilization units, scrub station, designing and finishing. So I'm sure we have discussed all this in our when you were in college. Factors influencing the number of operation theaters, again, which is nothing but which here what we are trying to talk is based on the size of the hospital, then you plan the number of OTs that's going to be in that particular hospital. So basically the factors including the number of operation theaters will depend upon the type of the hospital, the type of surgery that is being performed, the number of hospital beds, hospital policy. It also includes upon the average number of operations being performed maybe per week or per month, and the projected amount of emergency cases that actually is brought into that particular hospital. It also depends upon the average length of stay of the patients in that hospital. Also, the turnover rate in operation theaters. The time for OT maintenance is also a necessary thing to be considered, because we know that in the current day scenario, every hospital has got is all advanced equipments and gadgets and what that they use in order to assist or in order to aid them perform the surgery in a much better and easier way. So such equipments can be quite expensive, and again, it needs equal amount of maintenance to be done as well. So all this has to be really planned. Who's going to be taking over the maintenance, and the company that is being that has supplied us with that particular equipment has to be responsible for that particular kind of a job. Also, the various other factors also includes the staff, the strength and capacity of the sterile supplies, because you know that in the operation theatre, immense amount of sterile supplies has to be loaded, because that is what we use. There is no shortcut where you just rinse an instrument and you can use it on a patient. There is no way we do that. So we know that every little thing, every little equipment, or every little, even the blade, it's important that we use it once and then it's being discarded. So immense amount of sterile supply. So even for that, we need the backup of the central sterile supply department, which actually helps us in managing the sterile supplies coming through, and based on how it is being used up in the. Now, coming to the types of operation theatre, it can be classified based on sterility as ultra-sterile, sterile, aseptic. So, so this is how we can classify it. You'll be learning about this in the following slides again, which again we can say that you can also call it as like zoning. Okay, like how you can classify or can you demarcate the operation theatre area as clean, protected, sterile, and extra sterile. I'll be showing to you in the following slides. The classification also can be done based on the construction as modular or non-modular, also based on the timing of surgery, because not every surgery that is being performed is going to be elective or otherwise called as routine. There are also emergency surgeries that will be performed. So based on that as well, the hospital can be classified, or the operation theatre. Now, what is the advantage of grouping of OTs? Now, we know that when we are planning the hospital setup, it is very important we plan on which part of the building is going to be the OPD or the emergency department, on which level is going to be the medical wards, on which section is going to be the surgical wards, where are the intensive care units going to be located, and where, most important, if you know that this particular hospital offers surgical management, then it's very important you plan appropriately about where the operation theatres are also going to be set up and placed. And it's also important about how many operation theatres are also going to be set. So basically, if you have for a minimum setup of a hospital, you may have maybe 2 or 3 operation theatres. And again, it's very important about how you group them, because it's important that you locate, you plan the location in such a way that it's not going to be easily accessible, or not everybody can just pass through it or walk through that particular area, because it's very important we think about sterility. So the advantage of grouping the OTs is when we have them all set up in one particular area, it is very easy to shuffle the staffs. They need be in case of when there is shortage of staffs, and because you have always seen when you go to the clinical settings that operation theatre again is adjacent to your intensive care units or the critical care units, because what really happens is once the patient has had his surgery done, he's immediately shifted to the critical care unit or the intensive care unit, where he's going to be observed and monitored for a few hours. So that's very important. And again, when I say shuffling of staffs, it's basically like when we have a shortage of, because in the operation theater, again, if you remember, I have mentioned that you have the receiving end, you have the area where the surgery is being performed, and then we have the area where the patient is being looked after surgery, which is nothing but your recovery area. So such nurses are going to be very well skilled, and again, because you know that the patient may be having the endotracheal tubes, the drains, and the suture, looking after the operated area. So again, so all this needs extra skill and experience. So the nurses working in the critical care unit again will be able to support us with such help for whenever it's needed. So this is what I say when it is meaning it is easy when you have the entire sterile area on one part of the hospital, then it's very easy in shuffling staffs, and also to get the workflow is also going to be easy. Flexibility in use, and again in future, if you need any future expansion when you're trying to build up another operation theater or a room, it is easy because you just need to make an extension from that particular area. So again, there is no other portion of the hospital that is being disturbed, so there's another one advantage. Again, better training and staff utilization. That is exactly what I just mentioned to you in the beginning. Better utilization of equipments and instruments, because again, this is also one of the advantage, because as I told you, critical care units or the intensive care units also have their stock of sterile equipments, and in case we run out of any equipment, we always have a hand. We can always get them from this particular area, and also vice versa. Better cleaning and asepsis, because we know this entire, even the surgical ICUs are going to be other something which is going to be a sterile area, because not every nurse or not every medical personnel is allowed to just walk in through that area however and whenever. The idea for dog grouping is also to minimize infection, flexibility in OT allocation. Again, this allocation in the sense about how you delegate staffs for the routine shifts like morning shift, afternoon shift, and the night shift, or the day shift. So that is also helping us to shuffle nurses from the surgical area into the operation theater as well. Also, as I mentioned to you, for the better maintenance, because again, the entire area is considered to be sterile. So when you're looking after that, the maintenance aspect of it, it is better, because maybe you're planning on one particular day that the operation theater area is going to be under maintenance. So we know that no one else is going to be passing through in and out, or it's not going to be hindering any other departments in the hospital. So this is one of these are the advantages. The next adjacent to it may be the patient receiving bay, where you can actually where the patients can be waiting. You also have the anesthetic area where the anesthetist come and talks to the patient, and also maybe anesthetizes the patient before he's being wheeled into the operating theater room. Then you have the set of operating theater rooms, maybe like suite 1, suite 2, suite 3, depending upon whatever the number of operating theater rooms that you have. And again, you definitely need the change rooms, which is very important, the male change room, the female change room, the showers, the restrooms, everything is very, very important. And also the area to stock your sterile gowns or scrubs rather, when you come and when the doctors or the medical personnel come and change their clothes. So that is also an important area to be looked into, because all this becomes at the beginning of the operating theater, area. Then as you move into, you will see the operating theater rooms, and adjacent to it, maybe you are having your utility areas, you have your central stock, the sterile stock area, where all the sterile supplies are being loaded. And also you have a sterile preparation room, which is very, very important, where actually you're going to be setting up your trolleys, the sterile trolleys which is required for the surgical procedure. So that is also there. And also you have your sluice room, where it is again where you kind of rinse your articles before it is actually being sent to a sterile supply department for. We know that the air conditioning is very, very important, and also looking into the maintenance of it. The filters need to be changed, and always it's going to be it's not going to be a negative pressure room, it's going to be a positive pressure room, where there's continuous flow of fresh air. Again, you need all the equipment that is being used in the particular operation theater room, and again we need backup systems for all that, or backup equipments always handy. Also very important when you plan the area or the location, about the suction, the oxygen, the gases from the wall, the air, the oxygen, and also the anesthetic. And Very important about the storage space for the, as I mentioned, the common surgical supplies, containers for the disposables, which is very important because the amount of the biomedical waste that is being generated also has to be handled very, very carefully. You have a dedicated scrubbing area, a dedicated preparation area, a dedicated, what is that? Preparation area for the sterile trolleys. Also, you have a dedicated cleaning area for all the used equipments and articles. And also, you have there's always what is that? The operation theater layout or the map is always on the wall because again, it helps when there is the, again, as I said, maintenance is very important. So even the person who comes to clean, he needs to have an idea about what he's cleaning, what he's touching. So every equipment's details has to be on the wall somewhere, because when the person is doing it, he should not be mishandling it, or he should not be ending up breaking the stuff. So that is another thing. And also he has an idea about what has to be done, how it has to be done, what chemical has to be used, and how it has to be cleaned. It is not just like cleaning any other the reception area floors, because here he needs to know that the idea is about keeping it extra sterile. So even the cleaners or the person who are taking in charge of the cleaning department again has a big role to play, because they need to be given extra education on this particular. Again, several operating rooms are part of operating suite that forms a distinct section that we already explained to you, because this particular section in the hospital is going to be located separately. Again, besides the operating rooms, the washrooms, it contains the rooms for the personnel to change. That's exactly what I said, the change rooms, and again the restrooms, where the scrubs or the sterile supplies are being stored or hoarded, and also the storage and cleaning facilities, office, the front desk, dedicated corridors, and also very important. The air conditioning, as I mentioned to you, and separated from the department, so that the authorized personnel has only the access to come into this particular area, which is very. Now, what else are the other requirements that you need to look into when you're planning the setting up of an operation theater? Includes about, again, it's a repetition about the, what is that? The very important is about the temperature control. You need to have an air conditioning, and there should be positive pressure ventilation. As I told you, there should be a free flow of air, and even it should not feel humid inside. Again, the filters has to be looked into. Also, the lighting about the particular area or the location, there should be the cold light, which is nothing but the real white light. And again, because it needs to be what is that, you need to really see things very clearly. And again, about because you always see when the surgeons are operating, you've seen the overhead lights. It's the white light, so that you can have a clear vision. And again, no following of shadows. Again, that's also very important, because when you're operating on a patient, again, the way you position the lights, and there's no falling of shadows on the patient, because we do not want that surgeon to miss out anything and go and cut any other little portion of his body, or the tissue, or the skin. So again, all this has to be looked into thoroughly, and only then the lights are also being on the ceiling. So the operating lights are very important. The medical gas pipelines are important. Power supply, earthing, which is again related to your electricity, the power switches, and also very important is again, this is a repetition about the operating. The zones, as I mentioned to you, can be classified as sterile, ultra-sterile, clean, protected, as also the disposal. The sterile zone is nothing but your real operating theater room, the sterile preparation area, the sterile scrub station, the gowning area, and also the anesthetic area. So all these are considered as the sterile zone. Now the clean zone includes the sterilization area, the store area, the pre-operative area, where nothing but as I mentioned to you, where the patient may be brought into the to the operating theater, and he's waiting. And also the recovery area is also considered to be a clean room, and the OT, the staff and the doctor's rooms are also considered as to be the clean room. The protective area again includes the changing rooms, the reception area, waiting area, and the trolley bay. Disposal zone is nothing but where your dirty utilities or the equipment are being discarded, and also where the equipments are being rinsed and cleaned. Sterilization. Now, the other things that you need to look up by setting up the operating theater includes regarding the floor, the wall, and the ceiling. Obviously, we know it should be non-slippery, again, because imagining the number of cases that is coming through, even if there is any kind of spillage on the floor, it has to be easily visible, and we don't want any accidents or any staffs or patients or anybody for that matter slipping and falling over. So that's the kind of flow we need, which is nothing but non-slippery flows. Even the walls again has to be, it has to be which is easily washable again, and also most of it is going to be with the stainless steel part, because as I told you in the beginning of this session when we're discussing, there should not be any kind of stains, or which makes it difficult for any kind of stains to be remaining there. So whatever the splashes or blood splashes that has happened, again, it has to be easily wiped off, or it has to be easily washable, and again, cleaned thoroughly, and again maintaining the sterility aspect. The ceiling again, same as in the floor again, has to be usually in a position where it has to be able to hold the mounting lights, or the big huge lights that is being used for the operating the cases during the cases. So even that has to be. The OT doors usually are wide. They can be sliding doors, and also you may also see a portion of it may be like the glass cut, not the entire door, but a little portion may be glass cut. So actually, from the entrance, you can actually see the people waiting, or the who's coming in, and this for that accessibility. The scrub station is another important area. Again, you will be seeing in